Hi, this is Dr. Bill Thomas, and this is RealCareNowTV, brought to you by the Picker Institute, leading foundation supporting patient-centered care. And pretty excited today because Ronni Bennett is joining me. Ronni, how are you?
I'm terrific. How are you?
Really good. You know you're a hero of mine. You've been a hero of mine for a long time. Sort of the founder of the ElderBlogging movement in America.
Well, I don't know about hero. You're more my hero, I think.
Well, tell me about ElderBlogging.
Well, it's a bunch of old people who blog. I started 7 years ago because everything I had read about getting old was all about decline, debilitation, and disease. And God, I couldn't believe that's what I was in for the rest of my life. So I started writing about getting old, every possible aspect of it. Whether it's politics or ageism or culture and entertainment and sex and relationships. And it's grown now into a phenomenon. Lots and lots of old people are blogging now, and that wasn't true when I started. I could barely find 10.
Well, and the other thing I'm very proud to say is I've sort of been the time goes by geriatrician.
And we're so
I've
glad to
written
have
some
you
columns
back.
for you. Yep. Thank you. And now we're going to kind of supplement sort of blogging from a geriatrician's point of view with some video conversations. And this is the start of a brand new thing. So, let's jump into some questions. Let's see what do you want to talk about?
Let's jump right in. I've got a question for you. There are already not enough geriatricians to go around for old people in the United States. And as the boomers get older and older, the ratio is going to get much, much worse. What is that going to mean for us old folks and the kind of care we're going to get?
Well, I think there's a couple of things going on. If you look at the number of geriatricians in America, it's actually on a steady decline. There is no way we're going to have enough geriatricians here in America. So what we're going to have to do is teach all the other professionals, surgeons, internists, nurses, therapists, we're going to have to teach them how to do geriatric medicine properly.
So what are elders to do?
Well, I think what we have to search for are elder-friendly physicians and nurse practitioners and physician assistants. We have to find people who have an inclination for and a willingness to learn about caring for older people. Listen to me on this. Taking care of older people is as different from taking care of adults as taking care of children is different from adults. What it means is when you enter into elderhood, you have really specific needs, and you need to see a healthcare provider who understands those differences.
What can we elders do to help physicians help us?
Well, I think number one, show and demonstrate to the physician that you're interested in slow medicine. The way you want to be cared for is person-centered, it's relationship-based. It's not on how much that doctor can do to you. It's about doing just the right things at the right time.
I'd like to come back to this in another episode sometime and discuss this further.
I would like to also, yeah.
Would you tell our audience how they are going to be able to participate in our future conversations?
Well, I as a geriatrician, I love taking questions from people and answering people's concerns and trying to explain things to people. So I want to team up with you, Ronni, and I want to do some events where we're able to actually interact with the people who visit Time Goes By and the people who read your work, and I can actually offer some feedback and input to some of the questions they have. So I know you're going to set that up on Time Goes By, and I can't wait to get started.
I can't either. This is so exciting. Thank you so much for this today, and we'll be doing another one soon.
You bet. Can't wait, Ronni. Bye-bye.
Bye.